I want to get on my MFM soapbox for a second and tell you, anyone that's listening, that dental care is absolutely essential to proper pregnancy care. Refusing to do dental extractions, root canals, anything in a pregnant individual's mouth that is infected, abscessed because of the pregnancy is not standard of care, and it's actually shitty pregnancy care. We currently have a patient admitted, tooth abscessed, 26 weeks, and her tooth was removed. Abscessed tooth, it was bad, took it out, because that's what was best for her and her pregnancy. We have excellent guidelines on dental care in pregnancy and what we can do, which is actually a lot, when something like an abscessed tooth or a broken tooth or gum infection or anything else happens in pregnancy. We cannot just band-aid it with a bunch of doses of oral antibiotics or courses of oral antibiotics and say, wait until after you deliver to remove that abscessed tooth. The number of patients I have had transferred, that we have had transferred to our labor and delivery unit from outlying facilities because of neglected dental care, because nobody wanted to touch them because they were pregnant, until they get to way far along in their pregnancy and then something has to be done when it could have been cared for way early on, is mind-boggling to me. And it's not appropriate care. I'm going to tag in a caption a video I did more than once, but semi-recently, about what we can do in pregnancy regarding dental care. Funny you should ask. Where I work, we have 15 outlying clinics in our system that do obstetrical care, and they all get funneled down to where I work for their high-risk needs. As a result, I do all high-risk pregnancies, but that's beside the point. Anyway, I just put together a letter that is in our computer system for any patient that needs a note to be sent to a dentist for their care. And I'm just going to go through it with you. Number one, routine dental care can be done at any time in pregnancy. Routine dental care can be done at any time during pregnancy. In fact, an extra cleaning should probably be thrown in there because of the dental changes that can occur in pregnancy that can cause gingivitis, periodontitis, and other things. Dental conditions that require immediate treatment, such as extractions, root canals, and restorations of untreated dental cavities, may be managed at any time during pregnancy. Anytime during pregnancy. Dental x-rays can be done with shielding of the abdomen and thyroid. I would say that if the dental x-rays are needed, get them, because if it's going to change your management or it's needed for a diagnosis, then you need to get them. Just shield your abdomen and your thyroid. Next, local anesthesia can be administered. Examples would include lidocaine, bupivacaine, mepivacaine with or without epinephrine. Next, the use of chlorhexidine and fluoridated mouth rinses and xylitol-containing chewing gum to decrease oral bacteria can be considered if needed. Acceptable analgesics or pain meds. And if opioids are used for pain, they should prescribe the lowest dose and for the shortest duration. And those include Acetaminophen, which is Tylenol. Tylenol with Codeine, Hydrocodone, or Oxycodone. Codeine, Meperidine, and Morphine can be used. Acceptable antibiotics include amoxicillin, cephalosporins, clindamycin, metronidazole, and penicillin. The other thing to consider is this. If you're going to be in the dental chair for a prolonged period of time, laying flat or supine, you may not want to do that, especially in the second and third trimesters of pregnancy, because of the supine hypotension syndrome, where if you lay complete on your back, it can prevent the return of the blood flow to your heart just because of the compression of the uterus on the IVC, and it can cause you to pass out while you're laying down. So what you do instead is you elevate the right hip on the right hip on the pregnant patient by 10 to 12 centimeters, or place the patient in a 5% to 15% tilt to the left side to avoid supine hypotension syndrome. And then finally, these things are not recommended for dental care in pregnancy. Number one, Valium. Number two, IV anesthesia. Number three, general or inhalational type anesthesia. Number four, cycline antibiotics, like the tetracyclines, those types of antibiotics. And then finally, ibuprofen and other NSAID products are not recommended in pregnancy for dental conditions. That should do it. Hopefully this answers some questions for those of you who need dental care in pregnancy. Remember, your oral health is just as important as your physical, mental, emotional health in pregnancy. So be sure to go to the dentist, get those teeth cleanings, and do whatever you need to do. Don't avoid the dentist.